Hello and welcome to Neckwise Clinics. If you're suffering with vertigo, you've come to the right place. Over 50% of the patients that we see in our Neckwise Clinics are vestibular disorders. And if you have vertigo, this is a really important picture. There's three things that are involved when it comes into balance. Sensory information from the eyes, sensory information from the inner ear, which is this guy right here. These hair cells in the semicircular canal send feedback down this vestibular nerve into that green nuclei you see. That's the brain stem right there, and it's actually right where your neck sits. So feedback from the inner ear feeds back into the vestibular nucleus, sensory information from the eyes, and the one that nobody knows about, which is very important, is the neck. This is the atlas. There's two joints on the top of the atlas that fit right to the bottom of the skull. There's millions of nerve endings on these joints on the atlas, and they send feedback into the vestibular nucleus there. And those three sensory factors are all coordinated in the vestibular nucleus, and that's what coordinates balance. So you've probably been to the HENT. You've probably taken meclizine, antivert. You've probably been to the physical therapist and done the eye exercises at the vestibular physical therapist, and you're still stuck with this swaying or spinning type sensation that you have. If this is you, it's highly likely that it's coming from the neck, and you suffered from a trauma somewhere in the past, and you had an upper cervical misalignment, and at the joint level, the vertebra misaligns, and what happens is the muscles in the neck lock down. The joint doesn't move the way it should, and then those nerve endings on the joint surface give aberrant signals into the cord here, and this is why many people who suffer with vertigo, when they tilt their head back, it sets them off. But if they do it in the opposite direction, it doesn't, because it's putting mechanical stress on that pathway that's irritated from the misalignment. So what do you do to fix it? You come into one of our offices, you get evaluated. We find out if you have an upper cervical misalignment, and if you do, and of course if you want to do something about it, we take 3D imaging of the upper neck to look precisely at these joints to see how the segment has misaligned. Every person's out of place differently. Everyone's joints are built at different angles. And once we have that information that's unique to you and your misalignment pattern, we put you on a table and introduce a very precise force. There's no yanking, there's no pulling, there's no twisting in the neck. And the goal is to restore normal joint motion to the upper neck to relieve the irritation off the cord and the vestibular nucleus, so then the body can go through a healing and mending and repair process. So if this sounds like you, click on the box below that says free consultation. You can find one of our Neckwise offices throughout the country and get a free evaluation.